can't take these exams without having a very good understanding of prioritization. But I will show you one thing, the easy way, the most content-based way to prioritize, so that when you see a question, it will be easy for you knowing your content. So the number one is content. Master your content. To the content the best you can. I mean, master it. So that when you see a problem that is an expected problem for that condition, you don't just get trapped. That's all. That's number one. If you master your content, there's no question that they will give you that you can figure out what they're talking about. Two, there's certain things you have to pay attention. I know there's so many things out there, but you have to be smart when you see those strategies without content-based, because people get sick no matter what. So don't limit yourself with time. You can get sick 12 hours, 24 hours, 48 hours. You've seen questions where you have to call a patient. They are home. It passed 12 hours. So there's nothing like if you're 12 hours, then you're stable. No, negative. Don't limit yourself with that. Time is not that important at that time. Anything can happen in 14, 15, 16 hours. Okay. Don't worry about the individual gender. So gender is not a problem. The kid and the older patient, you know more, a kid is no more important than the older patient. And the sex of the individual does not matter. Male and female, we are the same. Look at the problem they're giving you. They're going to give you somebody's age. So they're going to give you basically the condition and the modifier. Those are the ones you need to pay attention to, the condition and the modifier. That's what is going to tell you what is the problem. If you pay attention to the modifier, you're not going to be trapped. Forget about the age, the sex of the individual. Pay attention to the modifier and the condition, and then the modifier. The modifier is your friend. They're telling you what is actually happening to the patient. This is the key. The condition will help you, the severity of the problem, and then the modifier. And then when you're selecting answers, you have to be sharp. So we are introducing what is the BESHARP. You have to be sharp when you're selecting the answers. This is just a tool. It's a versatile tool to keep you focused, because there's so many conditions that will be there, but it makes you focus that these conditions, when you see it, when you go to the ward, you start working, those are the things doctors freak out. Nurses worry about it. They say, hey, if I see this, I got to do something right away, otherwise the patient is dying. And it's usually a breathing problem. Most of the time, the patient is having a breathing problem, or they have some electrolyte issue that is all screwed up, or they are in sepsis, or basically they are in shock, or basically they hypothermia. Okay, temperature is very, very low. Okay, or they are hypoglycemia, right? This, when we see this, we start thinking like something is not happening, or the patient is having airway issue, or they have a neurological issue, or they have pain. But for this pain, it's basically life, limb, eyesight. The pain has to cause you to die. You're about to die, or you're going to lose your limb, or you're going to lose your eyes. And this is what BESHARP is full of buzzwords. We don't have time, but I can tell you all the buzzwords when you see in a neurological patient, a lethargic, somebody who has conditions that tell you these words. When you hear them, you will figure out that this is, and if you want to know more, you check out that 10 class, you see all those buzzwords. And when you hear it, it should be ringing in your ear. That's the key, right? So that is the way to prioritize a patient. You don't worry about the time, the gender, the sex. You pay attention to the modifier, to the condition, master your content, and then be sharp when you select the case. The be sharp lead you to whatever you think you should pay attention to. They may not tell you all the things I've listed. They will put it in the way, but you have to interpret it. The second thing about BESHARP is you have just 1 second. You have to be sharp. 1 second. Which of these patients do you want to give 1 second to? That's all. If you have to do one thing, and that thing has to be done in a second, who will you give your time to? That's all. That means you are being sharp. I say entry-level nurse, you are being sharp and say, hey, I'm worried about this. I don't have experience, but when I see this, I got to call somebody to come and help me. And that is all. That is what this is about. So how do you prioritize? Look at what I'm going to do. I'm going to be sharp in my thinking. I'm going to worry about breathing issue. I'm going to worry about electrolyte issue, sepsis, shock, hypothermia, hypoglycemia, neurological problem, airway, and pain that is going to lose your limb, eyesight, and your life. So that's what I'm going to worry about. And I'm going to pay attention to the modifier. I'm not going to be distracted. Did you see me say ABC? There's nothing like ABC here. Okay, I never mentioned ABC. Did you see me say anything about ABC? No. There's nothing. ABC does not make you think. It does not make you think critically. You have to think critically and be able to analyze the condition. If they give you these 4 patients, who are you going to see? Which patient first you'll be seeing? And that requires you mastering your content. Know that this condition, this is what is associated with it. And if I see it, I'm okay with it. If I see something that is unexpected, then you are being sharp. Be sharp means I'm seeing something that is an unexpected for the condition. And when I see it, I'm worried that this patient is in trouble. That's all. I'm being sharp when I'm able to identify unexpected finding for that patient. So let's get to it. That's all I have for you. So let's see what we can do. Right? I show you. And this is aware of all clients who need to be seen first. I told you, pay attention to your content. So what is the condition and the modifier? 45, forget about the age. Male, sex, never matter. Type 1 diabetes, condition. What is the modifier? Morning glucose. Do I expect somebody who have type 1 diabetes, morning glucose to be 250? Of course. I mean, she has diabetes, right? Did I say anything about having hypoglycemia, having distress? He's not going to die from it. The BESHARP I never mentioned hyperglycemia. I said hypo. You're more likely to get sick from hypoglycemia than hyperglycemia. There's a bunch of people working out right now. If you go to Walmart and check people's sugar, it's like some people are 250, 300 walking around. That is, they don't die from it. If you have a second, don't give it to this lady, because I told you, pay attention to hypoglycemia. It's more important than hyperglycemia. So don't choose number 1. 45-year-old male, you cancel it. Migraine. Okay, what do I expect? I'm being sharp, right? What do I expect in the patient with migraine? You have severe headache, that's your modifier. And the photophobia, that is an expected finding on the patient with the migraine. Of course, patient is struggling, is having issue. It doesn't mean you're not supposed to see. You have 1 second and there's 4 patients. I can't split the second into 0.25 seconds, right? I can't do that. I got to use 1 second for 1 patient. So I know you have migraine. I expect you to have headache. I expect you to have photophobia. When I do that, I'm being sharp. Therefore, I cancel you. Age, sex is gone. Acute testicular pain. Okay, your testicle, you have pain. Is this patient going to kill you? Is he going to lose your life? Are you going to lose your limb? That's the only time. Every time you see pain, tell yourself, life, limb, eyesight. If you satisfy this, it's your priority. This patient has a testicular pain. Is the pain going to lose this kind of pain? They're going to lose their life, limb, eyesight? Look at it. High riding testicle. High riding testicle is a definition of what? Testicular torsion. So this is one testicle is normal here. The other testicle is up here. High riding testicle, that means the testicle is up. That guy, he has ischemia to his testicle. If you don't do anything, he's going to lose his limb. His limb is his testicle. If you lose it, he's not going to be happy. You have to be sharp. So this guy, he has a red warning sign ringing at you. Hey, my testicle is too high. I don't expect my testicle to be high. I expect my testicle to be down. That is going up. It's not supposed to be up. It's supposed to be down. Therefore, you should be thinking, saying, hey, this is not normal. 45-year-old male. Okay. Acute left lower quadrant pain. Okay, you have left lower quadrant pain. And what is the problem? Left lower quadrant. What at all can give you pain over here? Then you have fever and a white count of 25,000. Content, like I told you, master content, and this will be easy. By these buzzwords, these are buzzwords. Left lower quadrant pain, white count of this is what? Diverticulitis. If you have diverticulitis, I expect fever. You have fever. I expect pain. You have pain. I expect white count. Fine. The normal does not matter. This can be 1 million. I don't care about it. It just tells you there's infection. Do you expect a diverticulitis to have left lower quadrant pain? Check. Fever? Check. White count? Check. So why do you want to select that? I never said rebound tenderness. That's peritonitis. That's buzzword. If you check BESHARP on Adapt NCLEX, you will find it. Did I said what? Broad-like abdomen. That's peritonitis. I never said that. Did I say diffused abdominal tenderness and guarding and rebound? No, I just give you the definition of diverticulitis. Fever, left lower quadrant pain, and white count of 25,000. The normal does not matter. This can be 11,000. This can be 1 million. It's still diverticulitis. There's no signs and symptoms of sepsis, which is what I told you on the BESHARP. Therefore, this patient is an expected finding. Don't let the board trap you. It all comes down to content, but content with being sharp. And that is how you prioritize patient. Therefore, number 3 is waiting for you to tell him or him that, hey, your testicle is in the wrong place. I want it to go down. Therefore, I'm calling the surgeon to take care of it. That's your priority patient. And you are being sharp when you do that. Sometimes they will make it easy, but very trappy. I have 6 questions. I try to design them to let you see the way the board can answer it. They will make it easy, but it can also be trappy. So you have to be smart. That's all BESHARP is about. That's why I call it introducing BESHARP. Just be sharp. Whatever method you've been taught and you used to, keep it. But I want you to be sharp. And when you're sharp, you're just looking for things that I know is associated with this problem. If I don't see it, I'm worried about it. And you worry about the breathing issue, electrolyte issue, shock, sepsis, airway, neurological, and pain issue. Well, I told you, age is not the problem, sex is not the problem. Therefore, they're gone. If you have CHF and your BMP is 1,000, you should not worry about it. What is the definition of CHF? That means you have BMP greater than 100. Is greater than 100. It can be 1 million, 10 million. It's still greater than 100. Did I say the patient has pink sputum, which is a buzzword, means they have pulmonary edema? That's signs of airway issue for somebody in CHF. Just having a CHF does not mean it's a priority. Go to the emergency room right now, or go to Walmart. There's a bunch of heart failure patients. They're on medication. They're walking around. We see them all the time. History of CHF. It's fine. It's on its laces. A bunch of medication. It's not a problem. This guy, good luck with that. COPD patient, don't expect the board to give you 100% saturation. But I give you PaO2 of 88. What else do you want? Did I tell you he's in distress, using intercostal muscles, retraction, wheezing to death? No, I give you a normal PaO2. Therefore, you cancel it. That's why I said pay attention to the content. And after the content, you got to be sharp. Age and sex is gone. This patient has what? Purulent, productive cough. What will give you a productive cough? Purulent. And he has white count of 13,000. Some form of infection. Is this patient in septic? Maybe. So we can say is sepsis. He has pneumonia and he's having sepsis, right? But I expect those findings. But that's what I have right now compared to 1 and 2. It's better than 1 and 2. So I'm keeping it as probably a priority because it shows signs of sepsis, infection, and productive cough. But what do we have? A Crohn's patient is immunocompromised. Is on what? Adalimumab. You should be able to recognize it that this is a bad medication. It's immunomodulator. It makes your immune system go down. If your immune system is down, don't expect a temperature of 107 or 104, 105, 102, 103. Your 101 is equivalent to a normal person whose temperature is 103. Therefore, this guy is more septic than number 3. 4 is more septic than number 3. How do I do this? Because I use my content and I know number 3 as pneumonia. I know number 4 as a Crohn's disease, and taking immunosuppression is more likely to get sick than number 3. Content, if you need it, adapt NCLEX will make you be comfortable for your NCLEX. So I'm telling you, Crohn's disease is more dangerous than pneumonia because I'm on what? Adalimumab, which make me immunocompromised, and I have temperature of 103. Therefore, 4 is your answer. 3 is not your answer. But it's trappy because I want to trap you. I want you to think, and be sharp in your selection of your answers. So 4 is dangerous. It's more septic than number 3. That requires some form of content. So that's number 2. Number 3, like I told you, I give you various ways the board can trap you and things they can put over there. It's not going to tell you it's BESHARP, but you have to be smart. That you see it, you say, oh, I got to be smart. I have 1 second. You may not see electrolyte issue there, breathing issue there, sepsis, everything. But it's the same strategy. Just go with the same strategy and don't be frustrated. Attack each answer choice with the knowledge you know, and just relax. Look at the situation. I said, look at the situation, forget about the age and the sex. The situation, that's the condition, and the modifier. You divide them into 2 and you conquer them, right? 37 weeks. Okay, first pregnancy. Hallelujah, right? But what? Twins. Twin pregnancy. And complain of dyspnea with exertion. This is content in disguise. At the same time, you got to be sharp. Is this an expected finding? She's 37 weeks and she has two babies, big babies inside, two inside. I've seen one pregnancy lady and their belly is so big. I mean, some of you female, you know, belly is too big. They can't even walk. How much more two? And therefore, when you exert yourself, do you think you're not going to have dyspnea in the third trimester? That's what happened. That's why they cannot walk. Two babies inside with gravid uterus and 37-week third trimester. Don't let the dyspnea be your problem and pick it. It's an expected finding in a 37-week-old lady who has two babies in place. Don't pick this. 36 weeks, first pregnancy, right? Placenta previa. I told you he has placenta previa, right? Therefore, I expect some bleeding, right? I did not tell you it's going to be recurrent bleeding. And she's getting what? Vaginal spotting, just tiny, right? Spotting. I did not say it's hemorrhaging. I said spotting. Your board has three words when it comes to bleeding. And I want you to master it. Don't get trapped. There is spotting, that means drop, you know. There is bleeding, that means it's more than spotting. Right? The flow rate is high. When you hemorrhaging, that means you dying. Hemorrhaging, basically flat gate. So pay attention to word your board will. If they say spotting is it's just like drop, right? When you bleeding, they will tell you you bleeding, it's coming. And when you hemorrhaging, it's hemorrhaging. This lady is what? Spotting. It has placenta previa. I've told you the definition of what placenta previa is. I've given you placenta previa. Therefore, you should expect lady to have what? Some spotting. Don't get trapped by the word placenta previa. 39 weeks, G1P0, new systolic mama on exams. Content over there. Always bring your content and say, do I expect this? If I expect this, then I'm being sharp. If I don't, yeah, I'm being sharp too, right? A 39 weeks old lady, the pregnant lady, do you expect a systolic ejection mama? That's physiology, physiological changes in the pregnant lady. If you want a good maternal health and child video, check out that NCLEX. One video, and you will never run away from it. So every lady with what? If you get pregnant, your blood volume doubles, it increases. Your body cannot contain it. You know, so you expect systolic, the blood volume goes up. You should expect systolic ejection mama. It's a physiological changes. It's not a bad problem. And don't get trapped with it. So this is normal. Content, right? I'm using content in this question. And if you need that, especially for maternal health, trust me, there's two videos there. You can watch them. You will see. 37 weeks old, G1, 35, G1P0 with the reactive contraction test on the monitor. Bring your content. What is contraction test? Contraction test is to see if the baby can tolerate what? Labor, right? What happened? We stimulate contraction, and what we're looking for, deceleration. When we see deceleration, it's a reactive test. We don't want to see reactive test. We don't want to see deceleration. When we see deceleration, you are in trouble. So this is another way of saying the baby is decelerating, is having deceleration. So I did not want to give it that way, put the word deceleration, but know that contraction test is positive. Hey, that means when you contract, your baby is going to decel and is not going to tolerate labor. Therefore, that's bad. We got to stop this test quickly. And then you intervene right away. Does that make sense to you? If it does, send me an email. But this is how you approach prioritization. It's not supposed to be hard. It's a bunch of content put together to see how much information you know. If you check the Q bank, that's all they do. There's nothing big. The same thing, the board is done the same. A bunch of content put together. So don't tackle prioritization until you master the content. That is the secret. For the first time, I'm telling you, free of charge. Don't look at a prioritization question and try to answer it without knowing the content of that. Don't do that, because then you have no clue what you're looking at. No matter whatever strategy somebody will telling you, do this and do this, ABC, crap, okay? Pay attention to the content before you look at the prioritization, and you make it easy. If you want to do OB prioritization, make sure you understand the OB well. Then you pick answers related to OB prioritization. And that is what I've done. This is all content on OB, and you put it in the prioritization. So don't look at them until you master your content, and then you do the prioritization. Like I said, there's a bunch of strategy out there. They don't make you think. They say, oh, use this, but you have no idea why. Like number 3, why it's normal to have systolic ejection murmur when you're pregnant, because your blood volume has increased, and that is content. Why a reactive test, contraction test is bad, because we're looking for deceleration. Therefore, if I see a deceleration, is the problem. There's no trick thing you can use to answer that. If you have a trick, fine, but just make sure you understand the content before you try to do prioritization. That's my gift to you. That is the key, because then you don't know what you're doing. It's not good. You have to understand the content, then you tackle your prioritization for that. So if you're having issues with prioritization, I encourage you to go back. If it's a GI prioritization questions, you having problem, go and look at the content under that, and then you can. Same thing like that. This is a bunch of what I just mix match them to see. So that requires you to bring a bunch. There's neuro stuff there. There's a endocrine, and there's a respiratory, right? Same thing. I'm not doing anything. I'm just like playing with words. And NCLEX is aware of 4 clients who need to be seen first. A client with asthma, and he has palpitation after albuterol. I told you his content. I'm not joking. Okay. Albuterol is a beta agonist. A beta agonist, what does it do? It will speed things up. When you see a snake, your heart rate goes up, because we activate the beta receptors. If I give you albuterol, it's going to activate beta receptors. I expect your heart rate to go up. You're going to have palpitation. Your heart rate goes up. You're going to have tremor. You're not going to sleep because you're trembling. Your heart rate going up. You're sweating. All of it is an expected finding. I'm not going to let the word of palpitation trick me and pick that answer. I know if I give me something that is going to speed my heart, then as a nurse, I should see something speeding the heart. On the monitor, I should see a heart rate of 110. I would say, okay, I document heart rate 110 post-albuterol, unexpected finding. Your charge nurse would say, excellent right there. This is exactly what you're seeing. Palpitation after albuterol. Don't worry about it. Yes, left Bell palsy. What is Bell palsy? You have cranial nerve 7 and paralysis from some viral infection. Okay, paralysis. I use the word paralysis. Things that don't move anymore. It's a motor problem. And what is the cranial nerve 7 does? It controls your face, facial expression and movement, not sensation, movement. Therefore, your face, that side of the face does not move. If my left side does not move, I'm going to draw from the other side. There's going to be drooling from that side. Saliva may be falling from there. If I put food from there, I'm going to drill. So drilling on the left side of the mouth for a left Bell palsy Unexpected finding. You should not be worried that, oh, it's drooling, that's an airway. No, it's unexpected. It's all based on the condition. So this, I'm not worried about you. Near drowning, it nearly drowned. And what happened? This is not the problem. It's hypothermic. And what did I tell you about BESHARP? I worry about your temperature. Low temperature is worse than high temperature in certain conditions most of the time. So hypothermia is more dangerous than that. This patient, I'm worried about him. Chronic kidney disease. This is our content. And what is that? His hemoglobin is 8. Should you worry about that? The kidney make erythropoietin, so epoetin. We make erythropoietin to help stimulate red blood cell. If you have kidney problem, you don't have erythropoietin. I expect a kidney patient, chronic kidney disease patient, not to make erythropoietin. They are anemic. That's why we give them epoetin shots. You see the content? Chronic kidney patients are always on epoetin because they are already anemic. That's why. So I see a chronic kidney patient, and I don't expect his hemoglobin to be 14. I expect it to be low. Therefore, this patient needs to be treated with an epoetin. That's why they're on epoetin. I never tell you it's on shortness of breath, is dying, or is in shock. That's where they live. They are like COPD patient. SAT is 89, 88. Chronic kidney patient, their hemoglobin is really, really low. They don't feel it because that's where they live. We give them epoetin to bring it up. When you give them epoetin, another content, you just want to increase the hemoglobin by 1 gram. So this will go up a little bit, okay? So not too much. So what do I have to do? This patient, don't worry about it. Near drowning and hypothermia is your problem. So that's my priority. And number 4, same story. 4 patients. Who do you want to see first? Both clients. Right. This is a problem, right? Right upper quadrant pain. He has temperature of 9/10. He's radiating to the right shoulder. Do you worry about this? There's no need for you to worry about it. There is no need. That's the definition. He has cholecystitis. You're going to have tea-colored urine when you have strep infection. That's post-streptococcal glomerulonephritis. The glomerulus is in trouble. That's fine. If you have temperature 101.5 and you're confused, that's dangerous, right? Because you're probably septic. But your blood pressure is that high and you have worst headache ever known, you know what it is. This is a subarachnoid hemorrhage. This patient is septic. This is an expected finding. This is an expected finding. This patient is screaming for you. He said, save me from this disaster. My blood pressure is high. I have the worst headache of my life. That's the buzzword. Worst headache of my life. If you don't touch me, I'm dying. I know I'm confused and I have temperature because I'm septic. But this patient is your priority. You have to be sharp. He has the worst headache of his life. That is a buzzword of subarachnoid. Subarachnoid is more dangerous than sepsis. He has intracranial problem. ICP is going to go up. Brain is going to herniate. And you will have Cushing signs that the brain is herniating. And you have to worry about it. ICP issue. So this patient, number 4, is dangerous than number 3. 1 is an expected finding. 2 is an expected finding. The only time to become a priority is when I tell you they have hypertension or edema, too much edema, and that will be related to fluid overloaded, and that will become an ICP issue. So how do you prioritize? Being sharp, and you know that 4 is a what? ICP. Let me show you what BESHARP is here. I know this and this is ICP issue. ICP issue is related to what? Neurological problem. Neuro is part of the BESHARP. Whenever you see a neurological problem, think about airway. So this guy has 2 problems. Airway is compromised and he has neurological problem. Therefore, we are in trouble. So 4 is your right answer. He has both ICP issue, is going to have neurological problem. And when you can maintain where your airway, because your breathing center is located in your brain. And when you herniate, you can't breathe anymore. So that's that question. And I think this one more, maybe more, I'm not sure. But we're not nubbed yet. And this one is the same thing. I try to play with words to see where you will fall. Who do you want to see first? It's all content. I told you to master your content before you look at prioritization. Nobody can teach you prioritization unless you know your content really well. If you have kidney biopsy, what are you going to worry about? Bleeding. The board and the bleeding is what? BESHARP is shock, right? They're not going to write shock over there. They're going to give you signs and symptoms related to shock. And that is what? Heart rate goes up, right? Respiratory goes up, right? Your blood pressure go down. You become anxious. You become restless. Your urine output goes down. You have change in mental status. You see how many things I put there? So they can put what? They can write you a question related to kidney disease, kidney biopsy, and they have 1, 2, 3, 4, 5, 6, 7 things they can put over there to tell you that this patient is in shock. 3 hours made what? 100 ml of urine, right? If you can take 30 ml of urine every hour, you just need 90 ml in 3 hours. If you do 100, you're good. So this is fine. I have severe, don't worry about severe, left calf pain. When does it happen? When I walk, and it's relieved by rest. That is what? Claudication. I'm not dying from it. This pain, it goes away when I stop. So stop walking and proceed again. Don't worry about that. I have AV fistula. What do I expect when I have AV fistula? Your content. This is our content like a lecture. There's 2 things you, the nurse, should be checking. What do you check for? A bruit and a trill. You have to know the difference. A bruit, you listen. This is listening. A trill, you palpate, you feel it. You feel for a palpable trill. In the bruit, you listen. If I listen, I hear a loud, that is normal. Unexpected finding, I'm being sharp. That's all. If you have done your job, carefully. You've done your job carefully, and you've eliminated 1, 2, 3. Don't get trapped. You got to pick number 4, no matter what, whether you understand it or not. Test taking strategy. If you know you've eliminated 1, 2, 3, don't even do anything to distract you. Pick number 4. Cerebral angiogram. Yeah. What do I expect? Bleeding. What I'm worried about? Bleeding. What are the signs of bleeding? I've given you over there. Heart rate goes up, respiratory goes up, blood pressure goes up, anxiety, restlessness, urine output, change in mental status. This one, I will see what? Kellen sign. I will see what? Gray Turner sign. Okay. Bruises in this in perineum. There's a bunch of things you can see. I have a bunch of video on cardiac catheterization to pay attention to. And this patient, heart rate is 105. I'm worried about it. The board is not going to tell you that it's bleeding, but I'm telling you that it's bleeding. I'm not going to put the word bleeding there. I give you signs and symptoms of bleeding. His heart rate is 105. You have to worry that it's bleeding. Probably is going to shock. And that's your priority. Number 3 is normal. So this patient is your priority. Number 4. And let's see if there's more. One more. And that's the end of it. Thank you for watching. I hope you get something out of it. So if you like the video, and share it with your friends. Take care of yourself. Have a good day and all the best of luck. Bye.